Since Massachusetts first started planning its approach to COVID vaccine administrations, Governor Charlie Baker has repeatedly stated this among his top priorities.
Communities of color and at-risk populations are prioritized in distribution timelines, and our administration will be focusing intently on reaching these individuals.
But in my recent conversation with Congresswoman Ayanna Pressley, she made it clear those efforts are falling short. In the state's latest vaccine report, Black and Hispanic people make up less than 3% and 4%, respectively, of those who've gotten at least one dose of the vaccine, compared to around 36% of white people. Of course, access to the vaccine may be part of the issue, with the reports of widespread difficulty surrounding the state's registration process. But a recent Boston Globe-Suffolk University poll raises concerns about hesitancy as well, finding just 11% of Black residents and 32% of Latinx in the state saying they take the vaccine as soon as it's available. And that's an issue my next guests have been working on. Here's Michael Curry at Governor Baker's press conference just last week.
There is a reluctance in the communities where I was born and raised in Roxbury about this vaccine. And I want to urge people to trust the science.
I'm now joined by Michael Curry, who's on the governor's COVID vaccine advisory group. He's also the president and CEO of the Massachusetts League of Community Health Centers and the chair of the National NAACP Advocacy and Policy Committee. Dr. Thea James is Associate Chief Medical Officer and Vice President of Mission at Boston Medical Center, an emergency room physician. She's also on Mayor Walsh's COVID-19 Health and Equities Task Force. Dr. Michael, thanks so much for joining us.
Glad to be here.
Michael, can I start with you? At that event last week with the governor, you spoke of structural racism. You also spoke about how equity is, and I'm quoting you, and will continue to be front and center in the state's rollout. I know that's the goal, but has the implementation lived up to the goal, Michael?
I'd say no. That's true for Massachusetts. That's true for the rest of the country. I think that there was an intentionality on the part of the governor's COVID-19 vaccine working group to build equity in to the prioritization. There are some challenges there, particularly as we're in 75 plus right now, and 75 plus is really weighted towards white people. It doesn't take into account that the population that is sicker, that are Black and brown, tend to be younger than 75, nor does it take into account the mortality rates. That being said, our plan here was a lot more equitable than much of the rest of the country. But it's the operationalizing of that plan that we often fall short, and I think we're falling short here as well.
How do you think it's going in communities of color, Doctor?
Well, I have to agree with Michael, of course, the facts that he just presented. But I also think that as a physician in a hospital that serves primarily patients from those communities, we are working nonstop right now in trying to create a plan to reach those people in that population. And it's more than just reaching them, but it's also addressing, the hesitancy that many people have. So sometimes, having access is not enough.
Well, speaking of hesitancy, Doctor, in a piece that Adrian Walker wrote about you in the Globe the other day, you were candid enough to admit that you had a bit of hesitancy. What was that about, and what caused you to change your mind?
Well, myself, like other Black and brown people in America, have not, in your lifetime, you've not been used to seeing yourself be prioritized. I mean, if anything, you always see yourself getting less than or getting an alternative option for this or that. And also having, sometimes negative experiences with the healthcare system. And so when the healthcare system brings something to you, you're more likely to question it and not accept it readily.
So were you able to overcome that hesitancy because you thought your way through it, or because you decided that as a leader in the healthcare community, you were a role model for others and had to do it? What motivated you to conquer that hesitancy?
Well, it kind of was a little bit of both, but what started it was being in a situation where I was looking at the various different ways in which people were not able to work, having to quit their jobs, roll back their hours, and essentially not being able to thrive, not being able to make money to take care of their families, and seeing them suffer in that way, and not being able to deal with that very well, particularly realizing that the only way we are going to, from my perspective, the fastest way to get back to people being able to thrive was going to be the vaccine, and the fact that I could actually be contributing to that by taking the vaccine. And I went through that for about 48 hours, 48 hours just of intense thought and processing, and that's how I came to that conclusion. And it actually, I felt much better afterward.
Michael, speaking of hesitancy, I heard a figure from the CDC yesterday that shocked me, maybe not you, that only 38% of people working in nursing homes across the country agreed to take the shot when it was provided to them. Do you have an explanation for that?
Yeah, I think so much. So it's not just nursing homes, it's hospitals, it's health centers. We're seeing that across the healthcare workforce, that Black and brown people mirror the hesitancy within the general public. They don't necessarily trust the science coming out of this really charged, politically divisive last administration, how quickly we came to the vaccine. They don't trust science and the history as we've been experimented on, abused, denied health insurance, and quite frankly, neglected within our healthcare systems. And I think all of those things have come full circle. And in this moment, people are hesitant. And I tell people all the time, so a young person, Jim, said to me, well, I don't know anything about J. Marion Sims and his experimentation on slaves, or Tuskegee syphilis experiment, or Institute of Medicine's unequal treatment. And I said, well, what you do know is when your mother held your hand tight, when you went through a bad neighborhood. And just like that, we transmit our reluctance, our distrust of a system onto our next generation. And we have a legitimate reason. And so do our healthcare workers, who also carry those same lived experiences.
So let's talk about addressing both of these issues. One, making people of color a priority, and urging them, when made a priority, to actually take the vaccine. Doctor, you said a minute ago you're working hard on this effort. Let's talk about the priority thing first. For example, I read something today in Baltimore. They're going door to door in communities of color and poor communities to sign people up. In Washington, D.C., obviously a predominantly Black community, overwhelmingly so, marginalized zip codes, as they describe them, are at the highest on the priority list. Are we doing any of those kinds of creative things here? And what other kinds of creative things do you think we should be doing?
We are definitely very actively exploring everything you just named and more. And so, we have meetings all week long. And, the goal is to not just be a hospital and expect people to come to you all the time, which is something we shouldn't even be doing if it was, before COVID, but going out to where people are and engaging with them, understanding their hesitancy more, letting them know that it matters to us, making it convenient for them, having people engaging with leaders in the communities who can represent the people in the community and work with us to work with them. And so we, everything that you named, again, and more, we are actively working on, exploring, and planning.
Michael, I should know this. Do we have mobile vaccination sites in Massachusetts that allow us? We do have them.
So there's meetings going on as we speak. It's an interesting note, Dr. James. My mother is at Brockton Neighborhood Health Center getting her shot right now. So I'm great about that. But I will tell you that I met with DPH. They're meeting with mobile vaccination options. Frederica Williams, Whittier Street is looking at mobile vaccination options. There's a lot of folks out here that are trying to find the resources. And I just want to acknowledge right now, both Monica Burrell, DPH, and her team at DPH, and the foundation community that have been reaching out all week to say, how do we get vaccines and resources in your hands? What do we need to do to support you? I think, Jim, we'll have all of the above in terms of options, but we need to do it quickly because quite frankly, we're falling behind and we're losing lives.
But with all due respect, Michael, we have to do it quickly. I don't understand why we haven't done, like when I hear the governor announce that we're going to have a call center by the end of the week, why didn't we have a call center, particularly for older people, on day one. But putting that aside for a second, I know, Michael, you were at a press conference today about Massachusetts becoming a sanctuary state, and it was not some abstract commitment to the issue. I think the way you're going at it is you're concerned because so many undocumented people are concerned about what might happen to them if they go to a healthcare facility, that barrier has to be removed. So can you expand on that a little bit?
Yeah, so one, credit to MIRA, the immigrant rights advocacy organization, has been really leading the charge. And Senator Eldridge, Rep. Balzer, and Rep. Miranda, who's been leading and putting the legislation forward. We know that there's a chilling effect. Even before COVID-19 and even before President Trump, former President Trump, and his anti-immigrant policies, even under Obama and prior administrations, we had really hurtful immigration policies where ICE would come and basically deport people. And the result would be that people would not come in for care. And now in the middle of a pandemic, they're not coming in to get tested, not coming in to get contact trace, get treated. And then we're afraid they're not going to come in to get vaccinated either. That is not in the public health's best interest for any person to not take advantage of those resources. And we're seeing that both in the people who are removing themselves from Medicaid and public assistance and those that are not coming in to our facilities to get treatment.
Doctor, I want to return to the issue of using leaders to urge people to shed their hesitancy. I know there are some religious leaders who have spoken to this issue. What else are you talking about, Doctor?
Well, certainly religious leaders, but also community-based organizations, who people engage with all the time and who trust. And again, as Michael said, the community health centers as well. So those types of people in the community.
Michael, speaking of leaders, I don't know if either of you saw, but starting with you, Michael, Kareem Abdul-Jabbar had an op-ed in the New York Times, I think it was yesterday, the headline of which was, "We should let some NBA players jump the vaccine queue," and the subtitle was, "Like other celebrities, basketball stars can help build trust in taking the shot." While it is true that Charles Barkley once said, we ain't no role models, well, in fact, athletes are role models. What do you think about that notion, letting high-profile athletes jump the line so that they, in turn, can urge people to take the vaccine?
Yeah, I think it's complicated, Jim. I think, what the studies have told us is that we want to see people like Dr. James get the vaccine and our scientists get the vaccine because those are the people we defer to all the time and trust their judgment. So if we know they got it, then it'll instill some confidence in us. Then there's a cascade of other people, elected officials, leaders of various organizations, our medical associations are all high on that list. I think athletes can help, but what concerns me is if we create too many people jumping the line for the optics of it, and then people like my mother who are 76 with two more comorbidities has to wait longer to get that vaccine. For every vaccine that goes in the arm of somebody that's not likely to die or to have an adverse outcome, we're preventing someone who really needs that vaccine from getting it. So there's a balance we need to reach with that.
I only have a minute left. Starting with you, Dr. James, I want to separate what leaders like you in the community and the healthcare field are doing. The state, if there was one thing that you would like to see the state do differently to ensure that people of color were more likely to get the vaccine to begin with, what would that be?
Get the information from them. I actually mentioned this today on a call. Ask them what it would take, for them to be able to get the vaccine. And listen to that and learn from that and do that, because they know better than us. We tend to sit in a room and plan it, but they know better than we do. Michael, what's the one thing you'd add to the governor's list?
I call this our national Katrina. I think about that sergeant, lieutenant in New Orleans who took over and took over the operations. We need that kind of an operation where we go into Roxbury, Dorchester, Lynn, Lawrence, with mass vaccination, where we put resources in community health centers, in our hospitals, and we get this done quickly. I think sometimes we're in our own way by overthinking things, but I really believe somebody like that general to take over and push this out.
Michael Curry, Dr. Thea James, good to see you both. Thanks so much for your time. I appreciate it.
Thank you so much.